Hi.
Hi.
Dr. John Dishler, one of my favorite segments. There's so much to learn about LASIK eye surgery, so many things people don't know about. We continually get new questions. Astigmatism is a big one. Astigmatism. We're going to talk about that. If you're diagnosed, your eye's kind of deformed, the shape of your eye. And then you're told maybe you can't have LASIK surgery. Our expert explains exactly what it is and what can be done to help your sight. Dr. John Dishler, the Dishler LASIK Institute. Astigmatism.
Yeah, Tom, you know, we thought of a clever little saying. We're going to take the stigma out of astigmatism.
All right, good.
Because, you know, that's the thing that's so confusing to people. What the heck is this astigmatism?
You're going to tell us.
Do I have it? Yeah, and, you know, the truth is a lot of people have astigmatism. It just means the eye is slightly out of round.
It's not perfect.
It's not perfect, but, you know, it doesn't mean it's a major deformity. People feel badly when they hear that they have astigmatism.
Yes.
And it gets complicated, you know, very quickly because it's this optical thing, and then they add other words to it like mixed astigmatism or irregular astigmatism. There's all different nuances, but the important thing is that in today's world, for most people, astigmatism can be fixed pretty straightforwardly.
See, it used to be that the laser could not follow the irregularity.
Right. It couldn't fix astigmatism. It could only fix nearsightedness. So a lot of people were told, oh, they can't have LASIK or PRK or vision correction surgery. But now with better diagnostics and with better ways of doing it, we can treat that just as effectively as we can, you know, nearsightedness or farsightedness. So we wanted to, you know, talk about that a little bit and let people know that that's not a concern.
So let's talk about what do they do if they've been told they could not have
the first thing is the question, do you have astigmatism? And there's some clues that you might. If things are doubled, if you see two of things, if you have trouble seeing things both far away and near, then you may have astigmatism.
And if you were told you couldn't wear soft contacts? If you're told you couldn't
wear soft contacts, or you needed special soft contacts, or you could only wear hard contacts, or you could never get good vision like you could with your hard contacts, these are all symptoms, findings that you may have this thing called astigmatism. And the thing to do is to come in and find out, because now we can not only treat small amounts of astigmatism, but even fairly large amounts, so that people who previously were not candidates for vision correction are potentially candidates now, and that your eyes aren't necessarily weak or deformed or in any way limited, and so people can enjoy the experience of better vision.
What is a mixed astigmatism?
Well, mixed means that your eye has the astigmatism in such a way that you're not nearsighted or farsighted.
Different parts of the eye are different. Different problems.
Yes, it's even hard to explain, but it means that you're both nearsighted and farsighted at the same time.
Because your eye, if you look at your lens has different parts to it, and if one is farther away and one is closer because of the irregularity, you could have sight like this.
Right, and that's sort of an example of what someone that has astigmatism things look like. Things can be blurry or doubled. Near and far vision can both be blurry.
And glasses doesn't help.
And glasses just don't completely fix it. A lot of people can actually see better after having their vision corrected than they could with glasses, because glasses just don't completely cut it for this all the time.
Okay, patients have a hope now of getting this taken care of. Is this more expensive because they have an astigmatism?
Well, not at our center. I mean, some centers, you know, parse this out depending on what the prescription is and so forth. We're not that way. So if we can fix people, if we can help people, it's sort of one flat price. So it's not more expensive, no.
No, because you do the same correction, the same price for all levels of correction.
Right.
And let's talk about astigmatism. If someone comes in, how do you find that out? Talk about your comprehensive exam. I think people need to know that, because some people may not even know they have it.
You know, another thing people are really worried about is, am I going to give the wrong answer? They're going to show me which is better, number one or number two, and if I have astigmatism, that gets tougher. But now we have these diagnostic devices that enable the patient's eye to be scanned in just a fraction of a second. They don't have to say anything, and it gives us a nice printout that we can show them of a picture of their eye showing, do they have astigmatism? How much do they have? What can we fix?
Okay, now this astigmatism here shows the
That's a diagram of a cross-section of an eye, and
Yes.
you can see that that eye is a little bit irregularly shaped.
Right.
And so the light going in doesn't have one focal point. It focuses to several different points in the back of the eye.
Whereas with corrective lens, you get that one point.
Yeah, corrective lens helps that. But the trick with the corrective lens is you have to be looking right through the very center of it. So look off to the side or down, and it doesn't always work really well. And that's where the laser vision is designed to return the eye back to a shape that is the shape that it should have. It's really a corrective procedure. It's not cosmetic. It's actually making the eye back to the shape.
It's actually reshaping the eye.
Reshaping it back to the shape that it needs to be. And from there, it's...
And all bladeless again?
All bladeless. And we're only removing just a very tiny amount. It's the thing that helps is that even people that have bad vision, their eye is very close to being correct. And it just needs a little kind of fine-tuning.
So if they're both near and far, the laser can take care of that?
We can take care of that, yes.
Okay, here's a special offer. We're extending this anniversary special. Now, anniversary because he's been on our show for now more than a year. $395 off custom bladeless LASIK. That's all bladeless LASIK. That's whatever correction you need. There's no upcharging. And it's the guaranteed lowest price because of that new patient exam, LASIK consultation, aftercare for a year. Again, that bladeless technology is very, very important. 0 down 24-month financing. You can call for details on that. Now we're going to extend this till September 30th. It's been going very well. He's seeing a lot of great people from this show. So spread the word. Remember, we're on YouTube as well now. 303-793-3000, 303-793-3000, or Dishler.com.